Welcome to this quick guide to understanding the costs of cancer care. In this guide, we discuss the most common medical-related costs for cancer care, practical questions that are important to ask as you learn about cancer costs, and information about resources that can help. This information may seem overwhelming at first. Even if you take just one or two tips from this guide, you may be able to lower your cancer costs and focus on feeling better. You can use this guide as a resource and refer back to it over time.
Cancer care can be expensive, and there are many things that are unknown about the cancer journey. Still, there are things you can do to gain more control over the treatment experience and possibly reduce costs over time.
When a person is diagnosed with cancer, the most common response is to focus on the disease, its treatment, and fears of the unknown. Often, people don't think about costs, or they didn't know that they can ask questions about costs of care up front.
Everyone's situation is different, but some of the common costs that cancer patients can plan for are related to medical care, such as physicians and other professional provider fees. Each provider will charge their own service fees. Diagnostic and tests costs. Labs, imaging, and other tests used by doctors to learn about your cancer each have their own costs. Treatment costs, such as costs for cancer drugs, surgery, supportive care, or other prescriptions. Hospital and emergency room fees, in other words, costs related to the places where you receive care. These fees can be expensive. Post-treatment service fees for things like rehabilitation, long-term care, side effect management, or home care.
There are other costs to consider. Related healthcare costs like treatment for other health issues such as heart disease or diabetes. Many people benefit from professional help to manage anxiety and stress, so they pay psychotherapy and counseling fees. Though there are free options online, many people want professional help for legal matters, so they pay costs for estate planning, a living will, or legal documents.
In addition, there are daily living costs to consider, like fees for childcare, transportation, parking, house cleaning, or food for special diets, or employment-related costs such as lost income, disability insurance, or other costs and decisions that affect income.
Health insurance-related costs play a role as well, like costs based on whether you receive care from in versus out-of-network providers or clinics, and costs related to health insurance premiums, co-pays, co-insurance, deductibles, or costs not covered by health insurance.
One of the most common issues related to a cancer diagnosis is the financial burden that's placed on a family. Some people have insurance and it's great, but still insurance does not cover every cost of care. And other people have no insurance or are underinsured. And right away, they're faced with trying to find ways to help manage the cost of care, whether it be through copays or the treatment they need or something experimental that's not covered by insurance. A lot of times people are forced to take a leave from their job, and maybe their job security isn't something that they can depend on, to go back to. Other people have to stop working because of the physical effects, and it's very difficult for people. It turns their life upside down, and trying to learn what the resources are, whether it be local organizations that provide support or national organizations that provide support, learning them pretty quickly in the cancer journey is crucial for people so that they don't get, their life turned upside down by the cost of care.
This is a lot to think about, and some costs can't possibly be predicted. Everyone's experience is different, and the true costs for care are often not known until bills arrive. The sooner you can gain a general understanding of what to expect when it comes to medical care costs, the better off you'll be. With knowledge, you can be more prepared and able to find helpful people and resources.
It's often a good idea to start by asking questions about your health insurance coverage. You should understand basic information about your health insurance, like what your policy will and won't cover. Your health insurance card will have phone numbers to call or a website address. Start by calling your health insurance company to ask about your plan. You can also look through your health insurance handbook.
Next, it helps to gather information about the care you'll need by asking your health care team questions as early as you can in the process. Ask about your specific cancer diagnosis, your treatment plan, and what to expect, both now and over time, so you can plan ahead. This includes questions about how often you may need treatments, the types of treatment you may need, likely side effects, and where you may need to go for treatment. Your goals for treatment, general costs for treatment, and what is and isn't covered by your health insurance. If there are less expensive but equally helpful treatments to try. Many more ideas for questions you can ask are found in the Frankly Speaking About Cancer Costs of Care book at cancersupportcommunity.org/cost.
Because there's a lot to learn during this process, it helps if you can bring a family member or friend with you to appointments. They can take notes, ask questions, and remember what was said. Be willing to accept their help. When you're armed with information, you can advocate for yourself or your loved one, and you can be better prepared to manage cancer care costs over time by avoiding unnecessary visits to the emergency room or unnecessary fees.
My name is Donita, and I was diagnosed with CML, chronic myeloid leukemia. If I had to give advice on how to look for cancer care, I would definitely start with your healthcare provider. They have a lot of resources. They've seen scenarios where your insurance changes and your deductible and your copay skyrocket. They've seen many different things. So they're aware of things that are able to help, because mine helped. Look out for if you're on a different prescription, you can look out for copay assistance programs. So someone, at least on your medical team, should be able to help guide you in the right direction.
For more information about how to manage the costs of cancer care, you can also take a look at the 10 Tips to Help You Lower the Costs of Cancer Care Quick Guide and the Understanding Health Insurance Quick Guide. The budgeting tool at cancersupportcommunity.org/cost. Organizations that provide financial guidance, grants, and other forms of financial aid listed in the resource section of the Frankly Speaking About Cancer Costs of Care book or online. You can also ask to talk with a financial advisor at your doctor's office, and if you'd like to talk to someone now, try the Cancer Support Community's helpline at 888-793-9355, where professionals can help you navigate financial questions, get access to emotional support, and identify resources or organizations that could help you.
The costs for cancer care and treatment are difficult to navigate. Just know that you can ask questions. You can talk with a financial advisor or your health insurance company, and you can find resources that may help you. You are not alone. Help is within reach.